Human Services PSA Aspects of Drug Abuse, Awareness and Prevention, as presented by Castillo, Aileen Figueroa, Alexandra Perez, Guerra, Lauren Penson, and Maya Gonzalez. In this PSA, we'll be talking about prevalence, underage drugs and drinking, drug abuse in lower income areas, drugs and human trafficking, drug usage specifically with fentanyl, and emergency situations and interventions. Prevalence. From 2002 to 2022, the total rate of deaths due to alcohol, drugs, and suicide have increased by 142%, from 74,000 in 2002 to 207,827 in 2022. The rate of deaths involving drug overdoses is a significantly higher rate. According to the U.S. Substance Abuse and Mental Health Services Administration, in 2022, around 70 million people in the U.S. aged 12 and older reported using one or more illegal drugs, and just under 10% of people aged 12 and over in the U.S. had a drug use disorder. This counts for about 1/4 of the adolescents and adult population.
Underage drugs and drinking. There are three main factors that could occur when people engage in underage drinking and drug usage, which are one's health impacts, safety risks, and social consequences. First, the health impacts. Underage drinking and drug usage could lead to irreversible damage to physical health and lead to worse symptoms and physical damage later in life. And with an early exposure to drugs and alcohol, there is a significant increase in addiction and could lead to more irreversible damage to one's cognitive functioning. Next are the safety risks, which usually consist of significant impaired judgment and can lead to the occurrence of accidents, violence, and crime in our youth. With impaired judgment, risky behavior may increase and poor choices could be made more in the future. And last, the social consequences. With underage drug usage and drinking, we can see the occurrence of strained relationships amongst family and friends, alongside negative impacts with school and even one's career. If one is brought forward with serious legal consequences, it could be difficult later in the future to land a job with a criminal record on one's background. In this graph, we can see that American children ages 12 and older have definitely had experiences with drug usage in their lifetime, but how can we prevent it? Well, prevention efforts help address the problem of underage drinking and drug usage at hand, but can also lead to better futures. First is education, and the programs for teens that educate and emphasizes the effects on drugs and alcohol at an early age, we can help teens learn about the dangerous consequences that could potentially occur. Next is goal setting, which can help teens develop into better versions of themselves and practice healthy living with the absence of substances. Next also comes healthy alternatives, where providing other options for youth to engage in their hobbies, practice skill building, any sports teams or fitness programs, or general community activities can help prevent the usage of drugs and bring people closer together. Which leads into my next point of having a support system, which can include peer support groups, family intervention groups, positive home environments, and access to counseling and addiction services. With these, many members of the youth can feel more supported and can reduce or prevent the dependency on drugs and alcohol altogether. Having role models in young teens' lives can also prove to help make a more positive environment, and having someone for them to look up to and learn from can foster healthy habits and reduce negative influences that may involve drugs or alcohol. And lastly, one's personal aspirations can go a long way in developing a life without the chances of substance abuse occurring. By helping our youth find their personal interests and passions, putting effort into their personal development, and further creating safe environments for teens can help them feel more motivated to work hard for themselves and not put themselves at risk under substance abuse.
Drug abuse in low-income neighborhoods. So although it isn't a proven fact in today's time, studies have demonstrated that those who struggle with financial difficulties are more likely to rely on drugs rather than those who are financially stable. And living in a low-income neighborhood where violence and danger is more expected than wealthy areas, it increases the chances of becoming addicted young. In many cases, those who struggle to find a job or don't get paid enough to live comfortably stress on the idea of their living status, and they rely on drugs to calm their mind. And as they continue to take drugs, they begin to act differently and become less reliable on the job, leading them to get fired or struggle to find new employment. This stress adds on, and so does the amount of drugs people take. And regardless of the reason why people begin to take drugs, many spend a great amount of money to fulfill their needs. Some could start with as little as a pack of cigarettes, and others spend almost half of their income on just different kinds of drugs. So this is obviously an ongoing problem within low-income communities, and it doesn't help knowing that their support resources are limited to them because of how much they cost. However, there are plenty of solutions to treating addiction, but it just falls on the individual and whether they want to take advantage of these resources or not. Having a support system such as family or friends or treatment centers specifically made for the lower income goes a long way so that a person knows people care for their well-being, and it's a great start to their path to success. And from here, people learn the effects of addiction, the consequences it leads to for themselves and their family, and it shows them how to improve for themselves and for the people surrounding them. And from here, they begin to learn how to control themselves and resist temptation so they can have a fresh start.
In the human trafficking world, drugs can be used as bait. A huge portion of kidnappers use drugs as a way to manipulate children and teens, often promising them access to drugs, such as alcohol, marijuana, and other drugs, and then exploiting them into trafficking networks. Addictions have big impacts on trafficking because once you can't stop taking a substance, it can be very hard to stop, and even give you ideas that have negative impacts on the brain. The National Center for Missing and Exploited Children reports that many abductions are carried out by family members, but a smaller portion involves strangers or acquaintances who may use drugs as a tactic. Treatment and services like long-term sustainable care plans, peer support, and survivor-led services should be developed that incorporate harm reduction strategies and recognize that relapse can be a part of the process of overcoming an addiction and exiting trafficking.
In drug usage, fentanyl is one of the major dangerous drugs. So what is it exactly and how is it being used? So fentanyl is a powerful synthetic opioid used medically to treat severe pain, such as post-surgical or chronic pain in patients who are tolerant to other opioids. It is an effective pain management tool when used correctly. However, fentanyl is also frequently misused in illicit forms, often appearing as a powder or mixed with other street drugs like heroin or cocaine. It is often laced in these illicit substances to make them cheaper and more addictive. So why is fentanyl so dangerous? You cannot see, taste, or smell fentanyl. A speck smaller than a raindrop can kill you. Its potency is 50 times stronger than heroin and 100 times stronger than morphine, which makes it particularly dangerous with the high risk of overdose and fatality. The growing misuse of fentanyl is a major driver of the opioid crisis. According to the CDC, reported a 72.2% increase in synthetic opioid overdoses from 2014 to 2015, which emphasizes its alarming impact. In 2022, drug overdoses emerged as the leading cause of death among people in California aged 25 to 54 years old, which highlighted the devastating impact of the ongoing substance use crisis. The highest overdose rates were observed in individuals aged 30 to 39, which is a demographic often in the prime of their personal and professional lives. This alarming trend shows the widespread reach of drug usage involving fentanyl and its cause to more fatalities.
Emergency situations due to substance abuse may be either life-threatening or legal emergencies. Life-threatening emergencies, such as suicide, heart attacks, strokes, or overdoses, must be treated in a medical hospital. Before starting substance abuse therapy, it is important to manage and stabilize any present illnesses or injuries. Substance abuse users who are arrested for drug possession, DUI, or other drug-related offenses require immediate assistance. After medical clearance and legal issues are resolved, workers can engage with individuals to address drug or alcohol dependence. Secondary intervention is a type of intervention that aims to reduce harm by treating health problems or diseases early. They focus on how to return users to their previous level of functioning before drug use. Drug users may need drug education programs, family therapy, or supportive counseling, or they could also participate in a 12-step facilitation. The goal is to accept, surrender, and active involvement in 12-step meetings and related activities. After a few months, users not physically addicted may be able to use moderately and still function appropriately in society. Chronic drug users can't use drugs at all and may be involved in 12 steps indefinitely.
Next is tertiary intervention, which comes with the goal of complete abstinence. It is important to recognize that medications such as methadone, LAAM, and naltrexone reduce dependency with those addicted to opiates, alongside antidepressants, mood stabilizers, or neuroleptics that involve the treatment of multiple mental disorders that may accompany drug addiction. Detoxification is necessary for those who prove to be held with a severe physical addiction, which may ease symptoms of withdrawal from a drug. The therapeutic community approach for helping past addicts includes recognizing dangers of addiction and encourages one to express themselves and their feelings relating to their addictions, which helps through the recovery process and regaining personal responsibility. Last is primary prevention, which are preventative acts done to reduce the chances of someone engaging with drugs or alcohol at an early age and teaching young kids of all of the future consequences that could result. Unfortunately, young kids are targeted for these preventative acts because by the time children enter junior high school, they may have already tried drugs. In order to counteract this, many strategies are given to kids to avoid the chances of it occurring, and by preventing them at an early age, the easier it will be to help avoid people becoming addicted or chronic users in the future.